So here's something you can do. You don't have to spend $30, $50, $100, $200 in health food stores for supplements and all that other stuff, though I support supplements, but you don't have to do all of that. You can do something. There's something that you can save money, because if you stop smoking, you save money. If you cut back on your drinking, you save money. If you cut back on eating all the grease, stopping at all these chicken joints, rib joints, and getting hot dogs and all the stuff that we run in there and get, you will save money. If you cut back on and start eating more fruits and fiber and what have you, you will not have to run out buying X-Lax and Phenamint and all this other stuff, because you won't have a bowel movement. And we have to get back to basics here. We have to get back to telling our people the truth and letting them know what they have to do to decrease their own risk of disease.
And within talking about that, because I mean, I try to eat healthy. I mean, sometimes I have lapses. Okay, I asked about the pizza because I love pizza. I'm guilty. But another thing that I find...
I'm going to stop right there, because the marketing people have done such a psych on us that here it is, stuff that we know is bad for us, and yet we are so psyched out by the marketing efforts to make us think that we're depriving ourselves of something that's killing us. That's the most asinine thing I've ever heard of in my life.
Well, what about water?
We don't drink enough water.
And that's one thing that I do. I do.
You know why? Because they've taken our natural thirst for water and changed it into a multi-billion-dollar soft drink industry. So you thirst water, but you want pop, of different kinds of pop. You want different kinds of juices or different kinds of drinks. But what you really wanted when you started out was water, was something to quench your thirst.
I just want you to know, Dr. Mason, that the majority of people that are doing this show are men, and they're probably like on the edge of their seats. I know in the control room, like on the edge of their seats, listening to this.
But this is the truth.
It's something that needs to be talked about.
And we need to keep saying it over and over again. There's no doubt, there's no question that cigarette smoking is not only addictive, but it is also a leading cause of cancer of the lung, which is the #1 cancer killer among men and women. Cancer of the lung. And it's totally related to cigarette smoking.
What about support groups? What about support groups?
We have a wonderful support group, probably one of the largest African-American support groups that meets at Mercy Hospital. It meets every second Saturday of the month at 11 o'clock. It is free. It is open to, you don't have to be a patient of Mercy. You can be a patient anywhere. I don't care where you come from, but it is, you can bring your wife, your girlfriend, your daughters, your sons, bring as many people as you want. We love having you. We have about 75, 80 people that come out on a Saturday, but it's the second Saturday of the month at Mercy Hospital. And they can get more information by calling 312-567-5567.
Okay. What is the cost
of the support group?
No, not the support group. But what would be the cost? Something I neglected to ask earlier. What is the cost of a basic prostate surgery?
Well, you know, one of the things that prostate surgery can vary depending on what you're doing, but it can be several $1,000s. But the test to check to see if you have prostate cancer, sometimes like today, although I know this may air later, but we have done and do free screenings where we will do a free exam, do the blood test free, and we'll do that, spend a lot of time and effort, maybe 30 or 40 people will come. And we will have gotten permission to do thousands of these tests for free, but we don't have but a few people show up. So I'm hoping that when people hear that certain organizations or groups are doing free prostate cancer screenings, we need to take more advantage of those things.
What other information about prostate cancer do we need to know, as if we probably haven't covered it already, but something that maybe I possibly could have skipped?
Well, I think the major point that I always want people to leave with is the fact that they don't have any problems, the fact that they're urinating okay, the fact that they don't have any burning, no blood, no pain, it means absolutely nothing. That you can have a small early cancer growing and not know it. Just like you could have a small tumor in your colon or a small tumor in your breast. If you don't take advantage of the early detection modalities, you'll miss it. One thing, doctors only can detect disease. We don't prevent nothing. You prevent. People prevent. And you prevent by changing your lifestyle. And I'm not talking about dieting, because I don't believe in dieting. I'm talking about you make a decision that you're going to eat to live. Just like Elijah Muhammad used to write. You got to decide you're going to eat to live and not to die.
Yeah, we really have to get back to our basics. As you said, the marketing arena has done a number on us.
Right. You think about how crazy it is. Let's take one of the commercials. You eat all the stuff you're not supposed to eat. You got a war going on in your stomach, fire burning. And what do? They don't tell you don't eat that stuff anymore. They say, no, take these pills. And it puts the fire out. So you can go eat this stuff again. Now, if it's making a fire in your stomach, you ain't got no business putting it in the first place. So it's a job that the marketing companies have done to support you got to understand that there's a multi-billion-dollar industry that's predicated on us being partially sick all the time, because that's what feeds, and that's what the over-the-counter drug industry is all about. And if we're going to take better control of our lives and begin to take some of our money and stop wasting it on these things and start doing something more constructive with it, this is the first step.
So make your way to your health food store, make your way to your doctors to talk about the proper diet you should have, go back to the basics of your 4 basic food
And if
groups.
they want to learn how to eat, you can learn how to cook. You ain't got to have that ham hock swimming around in there. You don't have to have that piece of salt pork. Folks boiling salt pork, using lard and all kind of craziness.
I hate to cut you off, but we have to wrap it up. I do want to thank you. And hey, as energetic as you are, please come back again, Dr.
Certainly will.
Mason.
You just call me. I'll come.
Okay. I want to thank all my guests for coming to the program today, the Russell Maryland Foundation, Eddie Reed, and, of course, Dr. Mason. Thank you for tuning in, and as always, until next time, God bless.